Hi viewers, welcome back to Health Simplified. In today's topic, let us discuss about menstruation, the different phases in menstruation and the common taboos and myths that is present regarding menstruation and how to overcome these taboos and myths. Let us first understand what is menstruation. It is a natural physiological process. It is a normal vaginal bleeding that occurs as a part of women's monthly cycle. Every month, the body prepares for pregnancy. If no pregnancy occurs, the uterus sheds its lining. This menstrual blood is partly blood and partly tissues from inside the uterus. Let us also know something about menstruation. Approximately 52% of females belong to this reproductive age group worldwide. In many of the countries, it remains as a taboo and a least likely talked about topic. And girls start with the menstruation from the age of 10 years to 19 years, and the first periods is called as menarche. Menstrual cycle is usually for 28 days. Sometimes it may vary from 21 days to 35 days. Each cycle involves the release of an egg every month. This egg, if not fertilized, then the lining of the uterus is shed along with the blood. This bleeding generally lasts for at least 3 to 7 days, with some days of mild flow and some days of heavy flow. The menstrual cycle may be irregular for the first 1 year and then it may become regular. Once the menstruation begins, it continues till menopause. What is menopause? It is usually the end of menstruation, which normally occurs in late 40s and mid 50s. During the first menses, most of the girls have lot of fear, they feel embarrassed and shame, as there are lot of taboos and myths not only in India but also in many countries. During her menses, she must not touch others, must not sleep with others, she must not cook, must not take bath or shower, must not go to places of worship, cannot go to school, and can't play or participate in any games. As our society is getting more modernized, these taboos and myths are not considered in many areas. But still, we need more awareness and education regarding this menstrual hygiene so that these taboos and myths are totally eradicated. Now, let us try to understand this 28 days menstrual cycle. In this 28 days, we divide the cycle into four, that is, menstrual phase, the follicular phase, the ovulatory phase, and the luteal phase. The menstrual phase begins from day 1 to day 5. The first day of the periods is called as day 1 of the cycle. Usually the flow is high in the first 2 to 3 days. Next comes the follicular phase, which starts from day 6 to day 15. Once the bleeding stops, the inner layers of the uterus, that is the endometrium, begins to thicken. so as to prepare for a possibility of a pregnancy. The endometrial bed becomes thickened and enriched with blood vessels and nutrients, waiting for a sperm to get fertilized. Now, the ovulatory phase begins from day 15 to day 24. During this ovulation, an egg is released from a mature ovum every month. This egg travels through the fallopian tube and reaches the uterus to get fertilized by a sperm. If it is not fertilized within 12 to 24 hours, then the egg dies and gets dissolved, and then you get your menstrual bleeding. Then comes the last phase of the cycle, which starts from day 25 to day 28. If the egg is not fertilized or implantation didn't occur, hormonal changes make the endometrial lining to shed along with the dead or the unfertilized egg. The next cycle begins with day 1. During this phase, premenstrual syndrome exists in some girls where they complain of bloating, breast swelling and pain, tenderness. Some may complain of headache, mood swings may be present. Some may feel heaviness in their body or weight gain may be present. Some have sleep disturbances also. In this video, we have learnt about menstruation and the different phases of the menstrual cycle. In the next video, let us discuss about the menstrual hygiene and the devices available to collect the menstrual blood. Hope this video was informative. Thanks for watching and subscribe for more videos.